Dr. Vanderhoff, if you'll allow us just another moment or two, we will continue to grant recording permissions and we should be able to begin shortly. All right, Dr. Vanderhoff, we are ready to begin.
Well, thank you. Good morning. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. Since the authorization of a COVID-19 vaccine for those ages 5 to 11, school-aged children are well on their way to enjoying the same protection from COVID-19 as most of the rest of us. In fact, as of yesterday, 11.1% of 5 to 11-year-olds in Ohio have already started the vaccination process. Nationwide, this compares very favorably, as the CDC was reporting this figure as 10.1% the day before. We're really encouraged that so many young Ohioans are rolling up their sleeves to get vaccinated. Many of them have also entered Ohio Vaxxed school drawings. And as you know, the first entry deadline was this past Sunday, November 21st at 11:59 p.m. By that time, there were 133,652 unique entries for the drawing. Next week on Monday, November 29th, we'll begin announcing winners. Each day, Monday through Friday, at approximately 3:30, 30 $10,000 scholarship winners will be announced. The announcements that week will include 75 winners drawn yesterday from Sunday's deadline and 75 winners that will be drawn next Monday following next Sunday's deadline. Finally, the grand prize winners will be announced on Friday, December 3rd during the lottery broadcast at approximately 7:29 p.m. Last Friday, the FDA and the CDC acted authorizing COVID-19 boosters for all fully vaccinated adults 18 and older. This broadens booster eligibility and also simplifies eligibility across the board. If you're 18 or older and are fully vaccinated, the only things you'll need to know are, number one, when you received your last dose, and number two, which of the 3 vaccines you'd like to choose for your booster. Those who originally received the Johnson & Johnson vaccine are eligible for a single booster dose, at least 2 months following their original dose. Those who received Moderna or Pfizer, which is also now known as Comirnaty, are eligible for a booster dose 6 months after receiving their second dose or additional dose in the case of those who are immunocompromised. Now, we're fortunate that the available COVID-19 vaccines continue to be incredibly effective. However, there is a natural tendency for immunity to wane over time, whether that's natural immunity or immunity from a vaccine. When fully vaccinated Ohio adults choose to get booster doses, it will keep their immunity from COVID-19 at peak performance. It's important to remember, of course, that there are still many eligible Ohioans who haven't yet gotten their first dose of the COVID-19 vaccine. If you haven't chosen to be vaccinated yet, please remember that the COVID-19 vaccines are safe, effective, and under constant, rigorous, ongoing safety review. And after millions and millions of doses over more than a year, they've developed a truly remarkable safety record. Now, as I noted last week, we continue to see rising cases and hospitalizations across Ohio. In particular, we're seeing quite a bit of this activity in Northwest Ohio. We've talked a lot about case rates per 100,000 residents in the past. As you know, this is a measure that allows us to assess and compare positive COVID-19 case data over a 2-week period. When we aggregate this data at a regional level, Northwest Ohio emerges as our state's highest region, coming in at 742.4 cases per 100,000 residents. The lowest region by comparison is Southwest Ohio at 401.9 cases per 100,000. Now, the CDC considers anything over 100 a high rate of transmission. So while we're still seeing high spread across Ohio, it's exceptionally high in Northwest Ohio. When you drill this down further, there are 4 counties in that area that are actually in the top 25% of counties in terms of vaccination rates. And those 4 counties combined have a rate of 50%, 57% of vaccine started, 53% vaccine completed, and their case rate per 100,000 is lower. It's at 569.3. When you look at the remaining 14 counties in Northwest Ohio, on the other hand, their vaccination rate is 46% started and 43% completed. And their case rate per 100,000 is much higher at 918.6. Now, while you can still see that cases are high in all of these counties, and in fact, in all of Ohio's counties, it's clear that a higher vaccination rate is correlated with a lower case rate. Simply put, it's a further demonstration of the protective impact of vaccination, and I hope a further encouragement for every Ohioan to make the choice to get the vaccine. Simply stated, unvaccinated Ohioans remain vulnerable to COVID-19 and its many after effects because they haven't yet chosen to get vaccinated, while those who are vaccinated are remarkably well protected, particularly against severe disease and death from COVID-19. So, as we look forward to the coming holiday season, as well as cold and flu season, please, if you aren't yet vaccinated, choose to get the vaccine. And if you are fully vaccinated and are now eligible for a booster, make an appointment or walk in at one of the many vaccine providers who accept walk-ins across the state. Staying up to date on immunizations has been an essential part of maintaining our well-being for decades. And getting the COVID-19 vaccines, as well as boosters, represents one of the best ways we can continue to protect our health. Now, today, I'm joined by 2 of my colleagues to further discuss the state of COVID-19 in Ohio. First, I'm joined by Ben Robison, Wood County Health Commissioner. Ben, the northwest portion of the state, as I noted, and where Wood County is located, is seeing a rise in COVID-19 cases. And this is clearly driven largely by unvaccinated individuals. Why do you think this is happening? And what advice would you have for residents of Northwest Ohio, Wood County, and really everyone statewide to help prevent the spread of COVID-19?
Well, good morning, Dr. Vanderhoff, and thanks for allowing us to join you as we talk about this important issue. Here in Wood County, we've actually been looking at data all the way back since August, and we've been tracking to understand how during this Delta wave of infections, vaccinations could help to impact that risk. And what we've noticed is that looking at data back in August when the cases began to climb initially, that people who have completed a vaccine series were about 3.5 times less likely to contract COVID over that period of time from then till now, compared to those who have not completed a vaccine series. Here in Wood County, about 2 out of 3 individuals ages 12 years old and older are fully vaccinated. They've completed their vaccine series. And so it's a large proportion of our population. And so while there is definitely a benefit seen in reducing the risk of infection, the greater benefit is seen really in the protection against severe disease. And so even when some of these individuals do identify as cases from week to week, what we're finding is that they're not often ending up in the hospital. And the cases that they're getting are often very mild, or they're cases that if they do experience more significant symptoms, don't cause them to seek additional supportive care. And so while there is certainly benefit just for being vaccinated alone to avoid infection at all, the greatest benefit comes from knowing that through vaccine you can be protected. Here in Wood County, we see that even more pronounced among our 65 plus population. About 90% of our 65 plus year olds are fully vaccinated here in Wood County. And they are 6 times less likely to have developed COVID over that same period of time. And we've seen a dramatic drop in impacts on this age group as they not only prioritize vaccination, but continue to make good decisions about how they gather, the use of masks in their social gatherings. And so what we're finding in Wood County is we continue to learn lessons from our grandparents, even during this pandemic.
Thanks, Ben. As I look across the state, I really do see some very encouraging signs. And Wood County is one of the places where I really see some of that encouragement. Vaccine rates are noticeably higher than in surrounding counties. As you noted, nearly 60% of the residents have actually engaged in the vaccination process. And Wood County, as I noted in my earlier comments, is in the top 25% of counties for vaccines started and completed by population here in the state. Now, while, as you also noted, we're still seeing some increases in cases, it certainly isn't as dramatic in Wood County as in surrounding areas. What's the secret of your success? What are you doing to encourage vaccinations that's making such a difference in your county?
Thanks. What we've really done is try to engage as many partners as we can in this effort. And that's not unique to us here just in Wood County. We've admittedly stolen some great ideas from our partners throughout the state. And what we've really done is to lean into those partnerships and to help them to work through their networks to make vaccines as widely available as we can. We're working closely with our schools on a regular basis to offer vaccine clinics for the newly eligible 5 to 11-year-olds, as well as 12 to 18-year-olds who may still want to be vaccinated, who haven't completed that series yet. We've worked closely with our Committee on Aging to make vaccinations and information about them available to their population, even providing vaccinations to individuals who are homebound and couldn't otherwise access vaccines if we didn't reach out to them directly. We've had support from our county organizations to do outreach calls. And as these boosters have become available, we've reached out to the individuals we've previously served who are particularly in those at-risk groups directly by phone call to make them aware of their eligibility, to point them to opportunities to be vaccinated, and to continue to provide information and to answer questions that they might have. We are really fortunate to have a great network of partners here who can allow us to reach a much broader population than the health department could reach on our own. And we really recognize that this community-wide effort and the support we've received across many, many sectors has helped to create a space for vaccination and has helped people to identify the information and the opportunities they need to be vaccinated.
Thanks, Ben. As all of us, I think, are already beginning to think about Thursday and the upcoming Thanksgiving weekend and really the launch of the holiday season. What recommendations are you sharing with your community about how to prepare for the holidays, how to stay as safe as they can heading into the holidays?
Thanks. What we're telling people is to really think about this in terms of what we hope to have happen with our holiday celebrations. Thanksgiving is a great time of the year. It's one of my favorite holidays to gather family and friends and to look back on the many things we have to be thankful for. And as we've continued to navigate through this pandemic, there are a lot of successes we can look back on and be thankful for the return to things that we had lost along the way. One of the things that we encourage people to do is to have a family plan, to think about how you'll connect before you gather. And so, to look at your symptoms, make sure you're not carrying anything to Thanksgiving other than the sides that you're supposed to bring. And what we've also done is partner with the Ohio Department of Health to make rapid tests available in a larger number in advance of this holiday. So here in Wood County and actually throughout the Toledo metro area and many other places in the state, people can get a rapid test. And these rapid tests are really great because they can be completed in just a short amount of time. They can be taken shortly before you engage in your holiday celebrations. And it gives you a chance to get another piece of information to see if you might have COVID and not have realized it. By taking this test in advance of your gatherings, we have a chance to prevent the exposure to COVID that we might not otherwise have been able to avoid because a person may not realize they have it, even if they're not showing symptoms or showing really mild symptoms. We've seen over the course of this pandemic that about 2 to 3 weeks after every holiday, we tend to see an increase in cases. And by taking some additional precautions like the symptom monitoring and introducing test use into this process, we have a chance to potentially change that trend and to reduce the risk of increased cases following the holidays. And that way, when we look back on these celebrations, we can think about the memories that were made and not so much the disease that we're fighting on the other side of our celebrations.
Thank you. Well said. Thank you, Commissioner Robison. Next, I'm joined by Dr. Tom Hertzlein, Professor of Medicine at the Wright State University Boonshoff School of Medicine. Dr. Hertzlein has clinical expertise in many areas, including infectious diseases. Dr. Hertzlein, we're off to a great start with pediatric vaccines. We know that in other parts of the world, their second surge of Delta has been substantially driven by unvaccinated youth. Why from an infectious disease point of view, are pediatric COVID-19 vaccines not only good for youth, but also good for the broader community?
As you said, it is good for the children to get the vaccine. We know that there have been some children who've died from COVID. Thankfully, it's not as great a risk for the elderly population. But even more so, you think about the amount of school that children are missing due to getting COVID or needing to be in quarantine because of exposures. And then lastly, the development of so-called long COVID symptoms and problems in children is clearly significant issues directly for the children. But in terms of the community as a whole, we know that that anyone that's unvaccinated and susceptible and an increased risk of getting COVID is then going to also be at risk of passing it along to others. For the case of children, it's within the household and schools. And so anyone that can be vaccinated and does get vaccinated is going to contribute towards, protect those around them and those that they're going to be exposed to and exposed to them. So I think those are many good reasons for children to be vaccinated.
Thank you so much. Dr. Hertzlein, boosters, of course, now are approved for all adults. How should those of us who are vaccinated think about that? Does it mean our vaccines aren't working, that they're failing?
Well, the simple answer to that is no, it certainly does not mean that the vaccines are failing. I think you mentioned earlier that we expected and we're seeing that over time, the amount of protection from the vaccine declines in an individual. And, we're very familiar with requiring boosters for other types of vaccines. We talk about, the tetanus booster. And so this is not at all unexpected. What we didn't know is how soon the boosters would be needed. Now that we have more follow-up, we have basically a year of follow-up for people that have been getting the vaccine, and more than that in other countries. And we recognize that once it's been more than 6 months, there's a significant benefit to receiving a booster. And so that's what the recommendations are for the Moderna and the Pfizer is 6 months is based on that data.
Well, thanks for that. Another development in the days to come will be the availability of some oral therapeutics for treating COVID-19, probably by mid-December. But it's also very clear that they won't initially be widely available. The supply just won't enable it to be something that is as simple as picking up at your local pharmacy. Given their initial very limited availability, how do those oral medications, when they become available, fit into the picture of managing COVID-19?
It's difficult to say with complete certainty what their role will be and how they'll fit in. But what I anticipate is that there will be guidance in terms of who is most likely to benefit, so that they can be directed to those individuals, people who are at highest risk of severe disease from COVID. And I think that beyond that, it's really hard to know exactly how they're going to be used. That's one of the things we're waiting on, is just not only just more data, but as the expert panels review the data, they'll make recommendations on the use of these medicines. And I think the most important thing, obviously, it's encouraging that there will be an oral treatment. The treatments that we've had have been largely limited to patients that have required admission. And the treatments that we've had have been, the only treatment that we've had that's really been specifically for people who are not admitted is the monoclonal antibody therapies. And they've been very helpful, but again, they're limited availability, and it's quite cumbersome because it's an injection or a infusion to receive those. So it's quite challenging to set that up. So it is encouraging, but should not be viewed by anyone as a replacement for vaccines, or I don't need a vaccine because there's a treatment now. There'll be there's not likely to ever be a situation where we can think of them as replacements for a vaccine.
Thank you so much, Dr. Hertzlein. Well, we know that COVID-19 can be unpredictable. It's certainly shown us that throughout the pandemic. What could be mild for one person could be severe for another. And with the easy availability of a proven vaccine, it really isn't worth taking a risk with your health or the health of those you love by putting off vaccination. Thanks to the COVID-19 vaccines, you can easily have a layer of protection between you and this deadly virus. So if you haven't yet been vaccinated, please talk to your doctor and get the facts. And if you're eligible for your booster, go out, get it today. Why wait? When a COVID-19 vaccine can protect you and those you love this holiday season, there's really no reason to wait. And now, Alicia, I think we can go ahead and take questions.
Thank you, Dr. Vanderhoff. Our first question today is from Brian Hamrick with WLWT.
Thank you. I appreciate you taking my question today. I know one of the questions we're talking about boosters and how often one of the big questions has been, how often will we need to take these boosters in the future?
Yeah, I think it's a very, very good question. Let me start off by offering some perspective on the boosters. One of the things that we know from vaccines for many other illnesses is the level of immunity that's needed by individuals and by the population is different depending on the amount of the burden of disease that the population is facing. And that is certainly true with COVID-19. The problem that we're facing right now is continued very high levels of COVID-19 activity in just about every community. In that context, you want your immunity to be at the peak of what it's able to be. in many circumstances, especially for younger people getting the boosters, what the booster is doing is elevating their antibody levels to an even higher level to help prevent them from acquiring COVID-19 or passing it on. But make no mistake, they're already well protected from the severe outcomes of the illness. Now, for older Ohioans, the booster really also is very important in reducing their risk of some of the severe outcomes, because as Dr. Hertzlein shared, there is some fading of immunity that's a natural thing, both with the exposure to an illness or the immunity that we gain from a vaccine. So what does that mean for future boosters? We don't know. It is entirely possible that these boosters will be it. It's also possible that we'll be looking and saying there could be the need for a booster at some future interval. It's just too early for us to tell. But the need for a booster is not surprising to physicians and is something that not only we've anticipated, but frankly, we've been talking about dating back to the beginning of the vaccine distribution. Dr. Hertzlein, you're an infectious disease doctor. This is certainly right up your alley. What could you add to my comments?
Well, not much. I think that you rightly pointed out that we just don't know. It's what the future holds. I think the epidemiology of of COVID has been very difficult to explain as to why it's going up and down, and to such differing degrees in different areas. And the immunity is, again, the general principle of a decline in immunity over time was easy to predict, but what that amount of time was not beyond our capacity to predict. And I think that it's reasonable to expect that to maintain high levels of protection, an individual will need further boosters in the future. But it may be, maybe once a year, it may be every 5 years. And I think that at the same time, what's going on with COVID is going to impact what the recommendations are. I mean, if levels of COVID drop off to very, very low, that's going to, have a implication for how important boosters are. So I think it's to be determined. There's a lot of data that is being gathered, both in the United States and around the world, pertaining to the duration of immunity. And so I think that we can feel good about the recommendations when they come out, that there is strong data to support those recommendations.
Thank you, Dr. Hertzlein. Our next question is from Jade Jarvis with WEWS.
Thank you so much. Dr. Vanderhoff, I wanted to ask you about breakthrough deaths, like people who have been vaccinated and have died from coronavirus. Are we seeing those cases start to rise statewide? And if so, are you concerned? What's the kind of guidance going forward? I ask because here in Northeast Ohio, in Tuscarawas County, 35% of their deaths from September 3rd to November 9th were people who were fully vaccinated. And it looks like Lorain County has had 13 breakthrough deaths this month.
Yeah, thanks for that question. Actually, this question has been largely answered and addressed by the ACIP and decisions regarding the boosters. The reason that the population over the age of 65 was in the first wave of recommended boosters was due to early indications of some degree of waning of that very strong protection against the severe outcomes of hospitalization and death. And so I would say that any Ohioan over the age of 65 who's had the benefit of a full vaccine series and now is, past 6 months from that original vaccine series, they should get their booster. It's clear that getting that booster helps to restore that high level of protection from hospitalization and death. But when we look at the numbers overall at the level of the state, it is still remarkable how few deaths we're seeing among the vaccinated, how few hospitalizations we're seeing among the vaccinated, and that the vast majority of hospitalizations and deaths continue to be among those who, in fact, are unvaccinated. So my message would be, if you're not vaccinated, especially if you're over the age of 65, get that vaccine going right now. And if you're due for a booster, go out and get it. It's vitally important. As I look at the population less than 65, I would say the same thing is true. However, I'd also recognize that it is true that your absolute risk of hospitalization and death is less than somebody over 65, but it's not nothing. And we certainly are seeing people in those age brackets who sadly are getting very sick and dying from COVID-19. Again, the vast majority of them are unvaccinated individuals. So I'll certainly turn to my colleagues on this. Commissioner Robison, you're a health commissioner, you see data at a high level. Maybe I'll give you a chance to start, and then maybe we can finish up with Dr. Hertzlein from an ID perspective.
Thanks, Dr. Vanderhoff. As you mentioned, we really are seeing a significant benefit for reduction in severe disease overall. And it's worth noting that as I shared before, more than 90% or about 90% of our 65 plus year olds are fully vaccinated. And because that group had the greatest risk for severe outcomes from disease, there's a dual benefit there. Number one, not only are they individually protected because they themselves now can fight off severe outcomes, but when they as an entire population have these high vaccine rates, it reduces the risk of movement of the virus within that population group as a subsection too. And certainly our population 65 plus are not only interacting with others of their age. And so that's why we think about the benefit of being vaccinated at a high rate. But what we're finding is that over the population overall, not only is there only a reduction in the risk of disease, as I shared, but also a high level of protection against those severe outcomes. And it's worth noting that as we look at the data too, particularly here in Wood County, when we've dug into cases like this, there are often other factors going on, other underlying conditions that complicate the risk for these outcomes, not simply the fact that they are vaccinated or not vaccinated. The focus on vaccinating those who are older or who have these underlying conditions is because of an understood increased risk for severe outcomes to begin with. And so what we're doing is by reducing that risk of outcome, we're giving ourselves the best chance to protect those who are most vulnerable, and also ensuring that population-wide that we reduce the risk of spread across our community.
Dr. Hertzlein, what might you add?
Well, at our hospital, I like to keep track of the individuals that are being admitted and how many have been vaccinated and those that are more severely ill and require mechanical ventilator. And invariably, the number of individuals that end up on a ventilator who've been vaccinated is a very small percentage and vastly overrepresented by elderly or people with significant immune compromised conditions. And we know that those are the individuals that need 3 doses. And some of these are individuals that had gotten their vaccine much more than 6 months ago. Again, they were in the early group of people being vaccinated. So if you look at it the other way around and you look at individuals who have been vaccinated compared to individuals who have not been vaccinated, there's a dramatically decreased risk of requiring hospitalization, requiring being put on a ventilator or dying for those. But it's important that, you know, if you're looking at statistics and you're looking at data, it's important that you're comparing, the right things and not just looking at random numbers.
Thank you, Dr. Hertzlein. Our next question is from Jim Province with The Blade.
Hi, this question is for Dr. Robinson. When someone is before you in Wood County who has not been vaccinated, what are they telling you as to why they're not vaccinated? How do you counter that? And why is it that Northwest Ohio is so much more less likely to be vaccinated than the rest of the state? Is it simply because it's so rural, or is there more at play here?
Thanks for your question, and I need to say first, I don't share the credentials of my colleagues on the press conference today. I can't claim to be a doctor, but speaking as a public health professional, when people have talked about the reasons that they're not being vaccinated, they cite a number of various things. They may look at their expectation of risk. They may sort of take an individual assessment of that and say that they may see themselves as less likely to have those outcomes, which may encourage them not to be vaccinated from their perspective. Sometimes they may talk about just what they've heard about the vaccine, questions that they have, and the information that they've received has led them to reach a different conclusion about their vaccine uptake. So, what I would really say is, just to echo the comments we've heard here before, is that we certainly know that there are certain ages where the overall risk of severe outcomes is lower. That's true for our younger population, but we've seen throughout this pandemic that even people in lower risk categories can have that unintended and really tragic outcome of severe cases of COVID. And COVID can be just really disruptive, not just in terms of the individual, but its cascading impact on families. When COVID gets into a household, it can lead to a series of disruptions from work and school. And so there's value pragmatically, even beyond the benefits that are found individually for protection against COVID. The other thing we'd encourage people to do is to really look to those trusted sources of information. We know that our physicians are vaccinated at a high rate nationally. And physicians are a great resource for answering questions, not only about the vaccine itself, but about a patient's individual condition. And so we'd really encourage people, you may have had a conversation with your doctor initially, back in December of last year or early in this year, but a lot of time has passed. And if you haven't had that conversation in the last month or so, we'd encourage you to go back to your physician, ask them again, what do you think about the need for vaccine right now? What do you think about my needs as an individual patient? And I think that those two approaches will help us to encourage those who've not yet been vaccinated to maybe reassess the situation and to take on a different approach as they think about not just themselves, but also ways to reduce the complications of COVID for their immediate families and friend groups.
Thank you, Commissioner. Our next question is from John Reed with Gongwer.
Good morning. For Dr. Vanderhoff, with people getting rapid tests as they're going to meet family for Thanksgiving and things like that, is that affecting the case numbers in any way? I mean, is that skewing the numbers at all, or are we seeing other evidence that this is kind of a resurgence?
Well, thanks for that question. Really appreciate it. And I think that it's entirely possible that the increased testing that we're encouraging as we head into the holidays could create some elevation in the total case counts. But the reason, there are a couple of things that I think we need to bear in mind. We're still seeing, alongside of that, meaningful increase, substantial increases in our rates of hospitalization. And those have nothing to do with the increased testing that we're doing out in the community. So if our increased positivity rate were exclusively a product of just looking more, we wouldn't expect that we would see increases in the number of people sick enough to end up in the hospital. And in fact, we are seeing that. So that tells me that the increases we're seeing are real. And moreover, we're seeing them all across the country. So there's every reason to believe that the phenomenon that is happening in the rest of the country would be happening here. So that's important. The other context is just think about where we are in terms of the total number of positive cases. The threshold per 100,000 is 100 cases per 100,000, and we are many times above that, both at a state level and at each and every individual county level. So COVID is everywhere, and it is still demonstrating an ability to spread very quickly, most especially among people who aren't protected by the vaccine. I think just for additional perspective, I might take advantage of having Commissioner Robinson on here. You know, he's in public health and also kind of looks at these numbers and thinks about them. Anything else you'd add to that answer, Commissioner Robinson?
No, I think as you've covered it really well, but I think that as we think about this issue of vaccination, generally speaking, you know, and testing in particular, and those two things together, you know, when we lean into these issues, we may see an initial increase just because we're looking for things you may not otherwise be looking for. Oftentimes we're going to say to people that, you know, we want you to test when you have symptoms. People may be taking tests right now that are without those symptoms. And so that may catch some cases you may not otherwise see, but we expect that what it will really do more than anything else is prevent the increased cases on the other side that we would have noticed after the symptoms develop. And so there may be an initial increase for cases we may not have seen, but our hope is that by catching those cases there, that we really see a reduction in what could be the post-holiday surge, thinking overall. And when we couple that with vaccine again, that's another strategy we have in addition to this test taking that further reduces our risk. And although if you're needing to start your vaccination level now, your vaccine series now, you may not have the protection necessarily by Thursday, but there's never a better day to start than today. And so if you're not already down this path, you can certainly access vaccine widely throughout the state. And we think that and if there is an initial uptick in numbers, we think that will likely be leveled off by what could be a reduction on cases on the other side.
Thank you, Commissioner. Our next question is from Jesse Balmer with USA Today Network, Ohio Bureau.
Hi, thank you. My question is, Michigan recently, in response to their increase in cases, is advising masking indoors for those 2 and up. I guess, would Ohio take a similar step, or are we in a less dire state than Michigan?
Well, thanks for that question. We've stated repeatedly now over the course of many, many weeks that our approach to COVID-19 and the Delta surge really needs to be a common sense one that uses all the tools that are available to us. The number one tool, and you're hearing us reiterate that here this morning, is vaccination. And we have opportunity there. We have Ohioans who are eligible to be vaccinated who have not yet been vaccinated, or to get the booster who haven't gotten their booster. So our number one message, the best protection by far that we can offer people, is to get out and get vaccinated. But there are a variety of other very important measures that we don't want people to forget about. Probably chief among those is the mask. Masking works. We have lots of studies that reinforce the fact that masking is a really important tool for helping to protect us and others from the vaccine. So, you know, this holiday, I'd ask that you're thinking about where you're going and what you're doing. Are you going into a high-risk environment? Are you going into a crowded environment, an environment where people may not be vaccinated? Think about wearing a mask in that environment. Commissioner Robinson, what would you add?
Yeah, I think that as we look at these issues, I think it's just being smart about how we comprehensively think about our COVID combating strategies. We know that as we are facing colder weather, people are being driven indoors. And so the things that we have been using along the ways continue to be effective. Certainly, I think one thing that we can't overstate is the importance of being tested whenever you have symptoms that could be caused by COVID. I think as we've had warmer weather, we've had an allergy season that has lingered and has complicated our understanding of whether those diseases are the things we normally battle with allergies or whether it could be COVID. And given how widely testing is now available, we'd encourage you, if you have symptoms that could be from COVID, seek a test. There are lots of free options throughout your county, wherever you may live, through pharmacies, local health departments. Many libraries and schools also offer tests. So take the opportunity to get a test. Talk to your doctor if you have questions about how best to be tested, and remember too, as we take every step that we can, it helps us to add layers and layers on to our strategies. So there's no single silver bullet that will solve this pandemic on its own. But when we take a series of decisions together and really think creatively about how we can deliver these activities and services and the things that we value in a way that's aware of the risk that COVID presents, I think it gives us our best chance, maybe not to eliminate the risk entirely, but to have as safe an experience during this pandemic as we can.
Yeah, and I think that what I would add is along that line of using all the tools that are available to us, let's remember where we are both in terms of very high rates of transmission of this virus, as well as the fact that while we're off to a great start with pediatric vaccinations, still most of our school students are not yet vaccinated. So continuing to wear the mask in school is a really good decision, a really good choice that school districts and parents can make to protect their children in their communities. And then also think about the ventilation. This is a respiratory virus, as is flu, in terms of how those viruses are transmitted. As we're gathering for Thanksgiving, let's think about whether we can crack the window. Now, I know it's going to be cold and the weather's going to be inclement, but there still may be opportunities for some increased ventilation in our homes, limiting maybe the size of our crowd, asking people who aren't vaccinated to maybe not join into a large group, especially one where they might get sick or get others sick. So these are all thoughts and considerations using all the tools at hand to help address the very high levels of COVID-19 that we're still seeing statewide.
Thank you, Dr. Vanderhoff. Our next question is from Danny Eldridge with Hannah News.
Hello, Dr. Vanderhoff. So my question's about school vaccine clinics. Can you just talk a little bit about how that works? It sounds like there's people who are, don't understand how they work, or they're upset about it. I know there was threats that closed some clinics in Colorado the other day. Can you just talk about, how the distribution to schools works, how those clinics work, and how children go about getting vaccines in school?
Yeah, that's a great question. Vaccination at school has been a very successful intervention already here in Ohio at a number of schools across the state, but historically also for addressing vaccine preventable illnesses in children. So the way it works in Ohio is really a way that is very mindful of the importance of parental involvement and consent in terms of whether children get vaccinated. It begins in most circumstances with a collaboration between schools and local health departments and or local children's hospitals to work to make available to interested parents and their children easy accessibility to the vaccine in a place that the kids are familiar with. It's really important that children be comfortable with the environment in which they're receiving their vaccine. And schools, one of those environments where children are more comfortable and are accustomed, of course, to going on a regular basis. But in every circumstance in Ohio, any vaccination clinic would be completely voluntary and would be one in which there's a very strong focus on assuring that any vaccinated child is one whose parent is clearly authorizing that vaccine to be delivered. We've had, again, great success with some of the clinics across our state. I don't know whether my colleagues have had experience with school-based vaccines or not, but let me open it up to them. If they do, sharing their experience would be invaluable.
Dr. Vanderhoff, this is, I can tackle that question. We have been working with our schools extensively. The first experience was all the way back when we did staff doses, starting back in February here in Wood County. And then as students became eligible, we worked with our schools to make times and locations available. What will happen here is that schools will send out information that they're hosting that clinic within their school networks. And as you said, it's 100% at the discretion of the parents and guardians if their students will be vaccinated. We, depending on the clinic, we'll do the opportunity to register in advance so that you can come right in at your time and get right out. But as you move through this pandemic, that became less of a need. And so many clinics, and it's important to get those details before you go, but many clinics allow you to walk right in. And we really work with our school leadership to provide that information to let parents and guardians know how they can access vaccine, whether it's in advance or on the day of. And then the students will arrive. I will tell you one thing that is a lot different with the 5 to 11-year-olds than with the older ages is that you're going to see some partitions up so that kids don't see each other getting the shot. Kids that are younger get a little bit more nervous when they see needles. The other thing to note, if you're a parent taking your kid to one of these vaccine clinics, is bring them in short sleeves or shorts. Maybe if it's cold outside, bring layers. Depending on the size of your child, they may want to.
Over the age of 18, consider getting that booster shot. So that's the first part of your question. And I'm sorry, could you just remind me of the follow-up part? You asked about the age.
Yes, so kind of with the ages, yeah, so kind of you answered that with recommending it starting at a certain age, but also if you've had COVID and have gotten both doses.
Yes. And so the recommendation is that even if you've had COVID-19, when you're 6 months past having had that second dose, and provided you have not recently had COVID-19, that you do go ahead and get that booster. In fact, there are good reasons to believe that you have just a more predictable benefit from receiving a booster than the the less predictable benefit that would come from having had COVID-19. So generally speaking, we do recommend those who have had a past COVID-19 illness still follow the booster intervals and recommendations as they stand. I'll turn to my physician colleague and see if he has anything to add. Dr. Hertzlein?
Thank you. I certainly agree with what your comments, Dr. Vanderhoff. The approval was, or the recommendation was for all adults 18 and up can get the booster. And as far, and I get a lot of questions from people that have had COVID and want to know, should they get the vaccine? And clearly people who've had COVID and subsequently get vaccinated have better protection than people who had COVID and don't get vaccinated. So I think that's, there's a lot of things that aren't certain about immunity to COVID, but I think that's one of the things that we're very confident of, is that getting vaccinated is beneficial and adds to your protection.
The last question I believe we have time for today is from Jordan Laird with Dayton Daily News.
Thank you. I just wanted to ask, how large of a winter surge in COVID-19 is ODH predicting compared to last winter's peak, and what numbers or trends are you basing that on?
Yeah, thank you very much. The reality is that no one in the country or around the world is able to accurately make that particular prediction. The pattern of COVID-19 has been one that, as Dr. Hertzlein mentioned earlier in his comments, has actually been challenging to use to develop good predictive models. What we know is what we're facing right now. And we are heading into the winter with very high levels of disease transmission. And over the last couple of weeks, a definite upturn in the number of cases and the number of hospitalizations. So, essentially, we're heading into the winter already in a surge. When this surge will peak and when it will begin to decline, we really are not able to answer that. However, as we also alluded to or addressed earlier, we've got some very hopeful signs, because it's clear that in communities and populations who are able to achieve very high vaccination rates, they see much lower activity of COVID-19. This virus is beatable, but it requires all of us working together and all of us who are able to go out and get vaccinated. Vaccination is our best protection against not only the virus, but facing yet another large surge of viral activity. I don't know, with this being the final question, gentlemen, if either of you have anything to add to that, I'll give you a moment to do so if you'd like to supplement that answer.
I would like to add that we do continue to learn more about the virus, and we've had significant challenges predicting future behavior, but it seems that the things that we do understand fairly well is that it's complex because there are many things that sort of affect what the community transmission and community rates will be, including not just the weather, but what behaviors of people. We know that vaccination is making a big difference, but how much are people inside versus outside? So it's complicated, and one winter may not be like the next winter, and same for summer. So I think that it's the one thing that we know is that we just don't really know exactly what to expect, and it may be very different from one season to another from year to year.
And if I could just add one thing, since we're talking about the winter, one of my favorite Winter Olympic sports to watch is toboggan. And when you steer a toboggan down that winding track, very much like our pandemic path has been, one of the rules is you lean into the curve. And so as we look ahead, we're not just at the mercy of COVID to just do what it's going to do. We have an opportunity by the decisions we make to lean into the curve that we want to see. And so if that curve is trending upward, by making smart choices, taking on those precautions we know about, limiting our sizes, using masks every time that we can lean into the curve that we want and see those cases begin to turn. So even though we don't know, we know we can impact what that might look like by how we engage this and how we think at a community level about what we do to address this public health need.
Thank you, Dr. Vanderhoff and Dr. and Commissioner. Since that was our final question, if you'd like to share any closing remarks, Dr. Vanderhoff, otherwise we can conclude.
I'd like to just wish everyone a safe and happy Thanksgiving. And I'd like to extend my special thanks to Commissioner Robison and Dr. Hertzlein for joining me today.